There's so many things you can do to change your environment, your diet, your exercise program, taking targeted nutraceuticals. You're an expert on detoxification. You know how to detoxify people. I remember going and visiting you when you were going into the health food stores and you were buying these detoxification formulas. So there's so many things people can do if they are dealt some bad genetics. And basically they can reverse that, because I, like you, believe that the environment trumps bad genetics.
Absolutely. So let's talk a little bit more about that. What are some things that women can do, knowing that they're vulnerable going into menopause, knowing that they might be vulnerable, having that family history? You know, we're all about empowering women and, yes, keeping them in a positive state, especially during this time in their life where they can then take charge, be proactive. So, you know, some different things they can do, as you mentioned, diet and lifestyle, right? Like reducing sugar, reducing high fructose corn syrup, you know, reducing hydrogenated oils, right? Choosing the healthier fruit sugars, choosing healthier oils like olive oil. I know you're a big proponent of that. Making sure they're getting lots of fresh fruits and vegetables for that good fiber that's super protective and helpful for not only their cardiovascular system, but their GI system, everything else, right? So many things that someone can do helps not only for cardiovascular risk, might help not only for helping them ease through the menopausal transition, but supports them, their bone health, supports so many different things, because our body functions as a whole, right? And so if we are optimizing our diet, optimizing our exercise and lifestyle, that has such a multi-factor approach on improving our well-being in so many areas and in going forward.
Yeah, and some women also need to take hormonal replacement therapy. I mean, there's no doubt about it. I mean, look, I'm a man, so I mean, you know much more about this than I do. But I remember seeing women on the opposite side of the aisle in my office, and they would say, "Doc, I can't live in my body. I can't sleep. I have these hot flashes that are driving me crazy. I'm getting palpitations. I'm getting arrhythmia." And I'll tell you, a lot of women in my practice were rescued with bioidentical type of hormones. And you know, we've done podcasts on this with Suzanne Summers and others. But I'm sure as a naturopath, women come to see you all the time and they ask you, you know, am I a candidate for hormonal replacement therapy? And what do you say?
Yeah, absolutely. I mean, I think like with anything that I'm doing, right, there's a therapeutic order and there's a hierarchy. It depends how bad someone's symptoms are, how much it's impacting their life. And because when women are going through menopause, you know, if they're having hot flashes, like you said, they're uncomfortable in their own skin, they're uncomfortable in their own skin at night. If they're having night sweats, it's affecting their sleep. That affects their energy. It affects their stress. It affects their mood. It affects so many aspects of their well-being. So if they're in having a really hard time with it, of course, we look at diet and lifestyle. We look at individual nutraceuticals that are indicated for them. And I have seen, you know, certain herbs and that sort of thing be game changers for people. But sometimes you do need the bioidentical hormones. And when you find that right dose in that right form for that right individual, it is amazing how many things improve for that person.
And what type of bioidentical hormones do you use? Do you use topicals, or, I mean, what's your favorite go-to?
You know what? I feel like with anything, right? Even if you're using, this is what I always say to my patients. It's a conversation between you and I on what makes sense for you and what you're going to take, right? Because you could recommend creams for someone, but they don't like taking the creams. They're all over. They worry about getting it on their partner. They forget them, you know? So in that case, a patch can be easier for them. Some people don't like the patch. Some people like the ritual of putting the creams on. And so I think it's individual. You know, usually, especially during the menopausal years, if someone's sleep is being affected, I do choose to give progesterone in a oral capsule at night, because it's when it's metabolized orally, it has an effect on the GABA system in their body, which can be relaxing and which can help with sleep. So that's kind of an extra bonus by taking the progesterone orally. And then I do like to do estrogen topically, but it depends on the individual if we're going to do patch or cream and what that's going to look like for them.
No, I'm glad you mentioned that. I remember a case in my practice. I'll never forget this, Brianna. It's a woman in her mid 50s, and she was menopausal, and she was taking medroxyprogesterone, a synthetic derivative. She was also on Premarin, and she was on this, program, and she developed high blood pressure while she was on the medroxyprogesterone, and she had a little leakage of the mitral valve. And this is amazing. With the skyrocketing blood pressure, probably due to the medroxy, she developed wide open mitral regurgitation. In other words, the higher the blood pressure, the more the valve leaked. And she was so short of breath, and she had an unsatisfactory quality of life. She went to see a cardiovascular surgeon, and he was going to replace the valve. Then she came to see me because the surgeon sent her to see me to get cardiac clearance. While I was taking her history, she told me about, the hormonal replacement therapy, the Premarin and medroxyprogesterone. And all of a sudden, because I was writing my book, Heart Sense for Women back then, I'm saying, oh my God, here's a woman going to get a mitral valve replacement when she needs to get off the medroxyprogesterone, and the blood pressure will come down. If the blood pressure comes down, the mitral valve will leak less, and then she won't need surgery. But she was ready to have open heart surgery when the whole thing corrected, just going off the medroxyprogesterone, So, I mean, that's a case I'll never forget. And I'm sure there's women out there now, who, have issues like this. So it's really important that, we bring these little case studies up to speed because, we learned from them. And if one case study can help a lot of other people, I mean, that's what it's all about. So I'm glad you're using the bioidenticals and you're using the patches and stuff like that. I think they're much better tolerated in a woman's body than the stuff that I was confronted with, decades ago.
Yeah. And it's always a conversation with that individual, right? Looking at their family history and the risk benefit ratio, which is always something that's an individual conversation between you and your healthcare practitioner to find out really what's right for you.